Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Delighted to be back with you on this rainy day, but that's what spring brings. So it is going to be a wonderful spring. We're so happy to be here this morning. We've got another great panel of guests. We, of course, have Hawkeye back, our Medical Director of Infection Prevention and Control, and Dr. Keith Sale, who is our Ambulatory VP, and Dr. Jennifer Woodward. They are some experts for us on how to help long haulers manage COVID-19 symptoms better and how you can stay home if you have acute COVID-19. So we're going to go through that discussion today. It'll be a great time, I think. Lots of questions have been popping up about the long haul clinic, which has been really busy. So this is an important event, and we're happy to be with you about that. But first, Hawkeye, how we do?
You know, we're going to start with a number first. One of the best numbers we could probably think of during the pandemic is 0.
Ooh.
So I would like to say that Hays has currently 0 cases.
Wow, that's very awesome.
That's
well
very
done. Good job,
good.
people of Ellis County and the surrounding communities. You gotta like that.
Keep doing those good behaviors.
Yeah.
Keep everybody out of the hospital. Here at the health system, we have 14 active infections with 3 in the ICU and 2 on the ventilator, still 18 in that recovery period. So number went down a little bit. You know, we had a couple discharges and a couple admits yesterday, so really kind of right on par from where we've been the last few days.
Yeah, and so that is still better than when we were at 125. We had gotten all the way down to 8. We were hoping that trend continued. It's popped up. Spring break, just still kind of going on. We really won't know the effect of spring break until April 7th to 8th, 9th, 10th. That's probably when we're going to see the effect of that. And hopefully vaccination and better behavior overall will help. We have to continue to emphasize the rules of infection prevention and control.
And the other issue to remember is, you know, the vaccinations are becoming more prevalent, which is good.
They are.
And their main efficacy is keeping people from severe and critical illness and death. So if we could see those lower ICU numbers too, that'll be a good.
That would be awesome. And let's talk for just a moment about the AstraZeneca data, which came back in. And I say come back in. I don't quite understand what AstraZeneca has been doing, because it sounds like their real data, somehow they mixed some of their prior study data in with their current study data. And when you do research, you have what's called a data safety monitoring board. And their whole job, they're independent people. They're looking at the data before the company and before the researchers get to see it. They're going to look at that data and make sure that everything looks like people are doing the study right, everything about it's been conducted in an honest and fair and open way. And when AstraZeneca reported their data, the DSMB, Data Safety Monitoring Board, said, wait a minute, that's not the data we looked at. And so they notified the FDA, notified the AstraZeneca, and AstraZeneca said, whoops, we put some older data in. They pulled that out, and then they said, here's our real current data. I don't understand why they made the mistake, because the real current data still looks good.
It's still about the same number,
Yeah.
So.
And it's odd, because in those above 65, actually, the data even looked a little better. And 76% overall efficacy in a 2-shot regimen is still really good, and could really be a part of an important armamentarium for the world. And the importance about the FDA is it's widely held as the most stringent certifying body for new drug therapy. And so much of the world will look and see, what is the FDA going to say about therapy? And so I think a lot of people have waited to say if the FDA is going to approve the AstraZeneca vaccine. What you hope is that the company's stumbles don't stop a good drug from getting approved. It can affect the world, providing that their data is real and they've got a good drug.
And it seems as if it is right now. And even, I believe, a couple of the European countries had stopped vaccinating older persons because it didn't feel like the efficacy was there. But it's interesting to note that the efficacy for those older populations is good as well.
May still have some concerns about the South African variant, I think, but that South African variant is not in a lot of poor parts of the world and to any significant prevalence yet. And I think it's important to note that the AstraZeneca vaccine really did a good job overall, and I think hopefully will be part of the armamentarium, again, providing that all their data is real when the FDA digs in, and I think they're probably going to go through it a little more painstakingly than perhaps they did with some of the others. All right, well, let's see if the reporter questions are out there, and then we'll turn to our guests. So let's first see any reporters.
Good morning. Cody Holyoke with Channel 9.
Hey, Cody. Welcome back.
Hey, thank you, sir. Well, we're talking about spring break quite a bit, but the head of the CDC came out saying it's kind of a two-prong concern right now, not just the spring breakers, but the eased restrictions around the country. And I was curious your thoughts on that as we're hearing more and more states are even considering just kind of rolling everything back.
Yeah, I'll be honest, it makes me nervous. But, we're dealing with COVID here, and even though the numbers are so much better, it does make us nervous because you don't want to do something prematurely when the real answer is only weeks away. And so, why open up the country? And I know there is a lot of political pressure, and I don't understand that. I'm not a politician, and so we have to stay on our lane around it. But from just a pure disease management standpoint, numbers are down, except now they're up in 22 states. Some states are rising very rapidly again because they have eased restrictions, and we don't have that many people vaccinated yet. And you're like, wait, guys, if you would just wait another 4 to 6 weeks, we would have so many people vaccinated. Opening up makes a lot more sense. But right now, I'm not sure it makes sense. And it's like, you're fumbling the ball at the goal line. What are you thinking? Here we go. Patriots, Seahawks. I'm going to throw the ball from the 1 yard line when I have the best running game in football as opposed to just scoring and wait, it's an intercepted. Patriots win. You just sit back and you look at that, you're like, what were you thinking? And this is one of those things, to me, it's like, okay, you're fumbling the ball at the 1 yard line, guys. You just got to wait a few more weeks. It'll have people be meaningfully vaccinated as opposed to the overall 13 or 14% of people.
Yeah, I would agree. I think we've seen that it's 85.5 million doses, first or second doses have been given. So we're just under probably about a quarter of the population. If you
with
take
one dose.
With one dose.
Yeah.
If you take out the young people and also continue to include those highest at risk, the nursing homes, we're getting there. It's happening. It's week by week, just as you said, 4 to 6 weeks. If we can wait on that, things will be much better. We'll have a lot more protection in general for the general population.
And especially because we are still vaccinating those who have other diseases. We can say, well, maybe those above 65 have really had a lot of opportunities for the vaccination and those in nursing homes. But the other really vulnerable group, and we know this from our own stats, right, and all the statistics you read, those people who have other significant diseases are at risk. So why not get them vaccinated, and then let's have this conversation about opening things up a lot. And that's what just makes me nervous. It just feels like the desire to be normal is so great, we're going to create more abnormality again. And God, again, you're fumbling the ball right at the goal line. Other questions? All right.
Great question from Cody.
It is a great question from Cody. Thank you. Well, Dr. Sale, let's start with you. Our viewers are really interested in learning more about the Long Haulers Clinic and how to access that.
Okay, so what we know, obviously, is that multiple studies are showing that a lot of patients have persistent symptoms. And it's not just the folks who are critically ill or have been in the hospital for prolonged periods of time. It's folks with even mild or moderate disease are having symptoms that will persist for weeks and months after that initial infection. And so because of that, we started to look at ways to kind of service those patients and to help care for those chronic conditions as they arise. One of the ways we're doing that is with we call it our post-COVID clinic as opposed to the Long Haulers Clinic, but there's a lot of different terminology for this out in the literature. Ultimately, it's for patients who have persistent symptoms that are lasting more than 12 weeks. And so there's really three categories when you look at some of the literature around post-COVID. There's the acute phase, which is those first 4 weeks. There's the subacute phase, which is that 4 to 12-week window of persistence of symptoms. Then what we, a lot of times in many other diseases, characterize as chronic, which is more than 12 weeks of symptoms. And so right now, because of the large number of patients that are out there and the variability in impact of symptoms, we're trying to focus our efforts on those folks who are sick for more than 12 weeks. And so in doing that, we think we can kind of manage the flow of those patients a little more effectively and get them the care they need without overwhelming the system, if you will. We also believe that in those first 4 to 12 weeks, your primary care physician is your best plan of action. That's who you should be talking to about persistence of symptoms, about initial tests, initial workups. And then if you still have issues those 12 weeks into this process, then we would love to have your call come our way. We set up a triage process with our COVID hotline team. where they really work through not only the referrals, but then actually will reach out to the individual patients and try and figure out what are the symptoms that you have, because oftentimes what we uncover is that it's not just one organ system that's the problem. It's not just their shortness of breath, it's the associated anxiety or depression, or it's the chronic and severe fatigue, it's the loss of smell and taste. It's more than just that one referral, and so through that process we can really help get patients to the right multi-specialty services that they need across our organization.
Yeah, well, that is really important. And we initially started by referring our own patients, but now we're about ready to open it up. Tell us what's going on.
Yeah, so as you know, as a big organization, we have a lot of things to work through to process our patients and to get them in with the right team at the right time for the right needs. And so to do that, we started with our internal patient population to kind of work through the kinks of our triage process and our scheduling process. And we feel like we've gotten a lot of improvements that we've achieved in those areas. And so I think the next step for us now is to expand that across the state of Kansas within our system, and then eventually and currently really to other physicians in the region that have patients who are in that 12-week mark. And so if there are primary care physicians who are out there who have been managing patients and they're at that 12-week mark and they're just kind of reaching their wits' ends, if you will, and want extra support, we certainly have the specialists who are creating time in their schedules to do that. Similarly, if you have patients in that 4 to 12-week mark who are reaching symptoms that are beyond your capacity or comfort, we also have access for those patients as well.
Yeah, I think that's really important. So what's the best way for a long hauler to get an appointment?
So the best way right now is to work through your primary care physician. We are still trying to go through that referral process, and so it's reaching out through your primary care physician to our referral process here at the health system. It just right now allows us to really streamline that flow. There are other ways to get into specialists, but it may mean delays. It may mean visits across multiple specialties that are spread out across weeks and months, as opposed to being coordinated across a very small segment of time.
So what do you think are some of what's the most prevalent long hauler complaint?
That's a really tough question. If you look at the studies that are out there, and Dana's probably the expert over here, but when you look at, it ranges from one study that says it's 50% of patients that have long hauler symptoms are fatigue, to shortness of breath. We see brain fog in a lot of our patients. We see myalgias, joint pains, muscle pains. All of those are things that our patients are experiencing. I would say the top probably 3 right now in our organization are pulmonary-based complaints, so shortness of breath, chronic cough, those kind of things. Chronic or debilitating fatigue is another common symptom, and then brain fog probably is right now the 3rd biggest one that we're seeing.
Yeah.
Okay, these are a big deal. I know you've been having to work with long haul clinics some as well, and it's certainly up your alley.
Yeah, just helping with Keith and Dr. Leslie Spikes and Dr. Brandon Comfort is what it started, and we've kind of expanded. But I think you named the 4 biggest ones really that we've seen throughout all of the analysis that have been done, and that's the brain fog, the fatigue, the cough or shortness of breath, and then interestingly, you also named it in the first time you were talking about it. The loss of smell is still a chronic one that it takes time to get over. We continue, unfortunately, from a infectious disease standpoint, there's not a lot that we can do. At this point, you're over that viral stage. You're really over that acute inflammatory stage, and these processes occur after that, and they continue to occur. We don't understand the full mechanism of why that happens. Is it just inflammation that is slow to resolve? Is it damage to those tissues? Who knows? But especially for things like the brain fog and the fatigue, we don't have a good understanding of that mechanism yet. Again, if we've heard anecdotes about people getting resolution or improvement in symptoms from vaccination, we think that's great. That still needs to be studied a little bit more, but hopefully that bears out to be truthful.
So, are you seeing people get better from their sense of taste and smell eventually?
What I'll tell you is that, the loss of taste and smell from a viral infection, truthfully, is not new. I will see 5 to 10 patients a year who have this, and just in my own practice, from the common cold or other respiratory viruses. So the fact that we see it in COVID is not a big surprise, being a respiratory virus. I think Most patients do see an improvement or a return to normal smell, but there are a significant percentage, anywhere from 20-30% of patients, who may have those symptoms persist beyond 12 weeks or sometimes even 3 or 4 months. And so what I tell a lot of my patients with loss of taste and smell is if you're getting that 6 to 12 month window of persistence, I start to worry about how much it might come back. There aren't a lot of great therapies out there or great studies that document improvement techniques. The most probably prevalent one right now is essential oil therapy, and I think we had Jen Vilwalk on not long ago. I think talk about this with loss of taste and smell, and so that would be a great reference. But ultimately, not a great proven therapeutic option out there for that.
And I think the important thing to remember about this post-acute symptoms is it's not just about the symptom. It's not like waking up and just feeling like an ache every day. These things significantly affect people's daily lives, and it affects their quality of life, and that is one of the main reasons why I think it's important that we have this multi-specialty group to kind of try to tackle this one-on-one with the individual patient to improve their quality of life. We know that over the pandemic, most people's quality of life has kind of decreased, and now you add on top of these chronic problems and issues can significantly continue to affect your quality of life.
Yeah.
Well, I think I saw Fauci even tied this recently to kind of an appearance of like chronic fatigue syndrome, right?
Yeah.
And kind of that manifestation of disease and that impact on quality of life. So it's fascinating to think that may be connected somehow to this viral process.
Yeah, and I've heard a lot of other anecdotes about, well, now the patients with chronic fatigue, and I think it's a different name right now,
Right.
but they're kind of saying, see, these things are real, and we've known they were real. We just don't ever have a good idea for the mechanism and what exactly is going on. It's been, if we're going right to chronic fatigue again, I think it's another name. It's been tried to be associated or linked with viral diseases. Those had not panned out. We don't know fully what happens in that. At least with this, we can say, well, you had COVID-19, and from there we know that you've gotten these symptoms from that. So.
Correct.
So the other thing just to point out is that patients may not have that many symptoms of COVID-19, and they can still get the long haul syndrome. It's not really linked to how bad your disease is.
True, yeah. No, exactly.
And so it's one more reason to wear a mask and follow the rules of infection prevention and control, because you don't want it. But if you do have it, you'd sure like to stay at home with it as opposed to come into the hospital. So Dr. Woodward, first of all, I'm going to bet you've seen some long haul patients in your primary care practice as a family medicine physician.
Yeah.
Yes, absolutely. And I've referred several to the post-COVID clinic, and it's been very helpful for those patients that I referred. It's, I think in addition to the things that you all have named, we have seen a lot of anxiety and depression, and, that kind of stems from the whole entire pandemic, but also, these symptoms that they just can't seem to kick. And so the patients that I've referred, they've been able to get in quickly, and I think the ease of it and the speed of which you can see multiple specialists really quickly is a real benefit to patients.
Yeah, that does make sense. And when do you refer your patients? What kind of made you think, I got to get this person over to the long haul clinic?
Yeah, a lot of my patients who are experiencing these symptoms, I'll see them very frequently after the initial illness. And so often we'll be doing telehealth visits, even every week, every 2 weeks, something like that, just monitoring and making sure they're on the right track. And if we get to that 12-week point and we're still having these lingering symptoms, that really we've kind of reached the limit of, from a primary care standpoint of, we've run the labs, we've done the imaging if we need to, those sorts of things, then that's the time when I kind of pull the trigger and let the post-COVID clinic take over.
Yeah, that makes a lot of sense. Now,
I would just say I think we need to give so much credit to family medicine and general internal medicine, because these providers are on the front lines every day to help with their patients, and they are very adept at dealing with them on a frequent basis to help improve that quality of life, and then, of course, get them to those specialists that are needed.
So you've been working with trying to monitor home oxygen levels to keep patients at home with COVID-19. Talk to us a little bit about that work.
Yeah, it's been really exciting. It was kind of a natural extension from a tool that we went live with actually in September. And that is a tool called MyChart Care Companion. And it's within our electronic health record, when our patients test positive for COVID, they are given the option to sign up for this tool. It's called Care Companion. And so on either an internet browser or on an app, they can go in and for 14 days after they test positive, they're able to submit their symptoms, and including an oxygenation level if they had a pulse oximeter at home. And from there, if symptoms are worsening or something is, all of a sudden much worse, then our chronic care managers are getting that data daily and will reach out to those patients and make sure that, number one, they're doing okay, and number two, that the next step, so sort of triaging what those worsening symptoms are and what should be the next step, whether that's a telehealth or an in-person visit, or even in some cases, suggesting that they go to the emergency department. And so we had such good feedback from those care managers and also providers providing telehealth that their triage capability and the support that they're able to provide was vastly improved when they had an oxygenation level to go along with all of the data and all of the symptoms. And so that was sort of the next natural step, is to see if there's a way that we could kind of expand the access to pulse oximeters. So that's kind of where we are now. We've just expanded, and we've got pulse oximeters that patients, when they test positive, and if they meet certain high-risk criteria that would put them at higher risk of worse outcomes if they did get, or when they do have COVID, then they can either drive by or, and pick up a pulse oximeter or send someone to pick it up.
Yeah, very cool. Well, and you described a little bit about that. How often do folks have to monitor their oxygenation during the day?
So the online app or the web browser version asks at least once per day to enter the oxygenation levels. And then for our patients who aren't on the online app, we decided that we really wanted to expand access to even patients who weren't on our electronic health record portal. And they receive some information on how to check. So we really ask that it's like at least twice, maybe 3 times a day, kind of checking in on those oxygenation levels and writing them down. And then they're given some criteria so that if those oxygenation levels start to drift down, there's a phone number to call. For our patients who aren't on that portal, they now have a phone number that they can call that puts them in touch with a nurse and can answer those questions and can help to triage.
Oh, that sounds really cool. And just to say, pulse ox is really simple to do. You just put a little device on your finger, and it tells you how much oxygen's in your blood, and you get parameters for how much you want to have, so you know when to call or have people be alerted. So are other departments trying to follow your lead around this?
We've been working with the emergency department staff as well. So we've had a really great team of people that includes primary care, the nursing staff, the emergency department staff, and our IT staff as well, who's put together this whole kind of support team for our patients with COVID, whether they're on the electronic health record portal or not. And so in the emergency department, they're also able to provide these pulse oximeters for patients who come in and test positive for COVID. They can go home with the pulse oximeter and the phone number to call if things get worse. They receive education in the emergency department. So really trying to make sure that we've got access points for these pulse oximeters, anywhere that patients kind of touch the health system.
That's amazing. So, okay, so what's the watchword to COVID-19 patients out there? What's the bottom line that you want to make sure everybody knows?
Well, we just want to make sure that our patients really feel supported, when they test positive. They've got the information that they need to keep themselves and their family members safe. They know how long that they, need to isolate, and know when to call and ask for help, and what that contact information is, so that they can easily go on to the next escalation of care if necessary.
Yeah, that's great work. So thank you for helping lead that here at the health system and to take such great care of patients. Mm-hmm. That's the kind of innovation we've learned to expect from our family medicine department, and to Hawkeye's point, our general medicine, family medicine, primary care, Jayhawk groups, they all do amazing work taking care of patients out there. And to all those general medicine, primary care physicians in our community and region, thank you for the great work you do. It's one of the hardest jobs, and there's just so much constant work when you try to take care of the whole life of a patient. So thank you for that great work. All right, Jill, I bet there's some questions.
There are. I think we're going to tackle a very serious and perhaps maybe even controversial.
Okay.
That is, we have 2 threads and 2 discussions going on Facebook, and we also have a reporter now who wants to to hear your thoughts. So I'm going to start with the conversation that is a little bit troublesome. I guess yesterday there was a woman who died after some time at Stormont Vale, and the obituary is saying that she died of her vaccine. Apparently, the patient had a history of reactions to vaccines. She got her shot on Tuesday, went to the hospital maybe later that day or on Wednesday, not clear, and then the obituary said has declared her to have died of the vaccine. And people are reacting to this, and they're wondering, what would your initial thoughts and I know you're hearing it for the first time.
Yeah, it's the first
so
time
what
I've heard
questions
about it.
go through your mind, and
Yeah.
what is your thoughts?
Yeah, first of all, I just don't know enough, and I would have to know more of the actual circumstances of death, and unfortunately, patients die, people die every day of disease, right, or accidents or what have you, and the question is, in my mind, when somebody says they died of the vaccine, okay, so what are the circumstances that make someone say they clearly died from the vaccine when we have, we've given over 50,000 individual shots here at KU now, and we've not had any deaths. There have been millions across the country and around the globe, and we're just not seeing deaths from vaccines. So I'd want to know very clearly in my mind before somebody said they died of the vaccine that in fact that happened to that person after they were vaccinated was uniquely due to that vaccination and nothing else, because people die every day whether they've been vaccinated or not. And what we know is that if you put it on balance, there have been over 500,000, now approaching 600 deaths in the United States, millions of deaths worldwide from COVID-19. I would really be concerned that people would hear this and then they would say, oh gosh, I don't want to die from the vaccine. Okay, well, there are millions of people who have died of COVID-19, and to date, no proven evidence, including, and we look hard for this kind of stuff, none here and none anywhere that can show that you've died of a vaccine. And I don't know there's enough about the patient at Stormont to understand that. But having been an ICU physician here for many, many, many years, having filled out hundreds and hundreds, like thousands of death certificates, I will tell you that you try to list the causes of death, and you have to be very clear about that. They're not just something you do arbitrarily. And you really want to have a good understanding of the mechanism of death before you would attribute to something like that. And the only way to know that is to ask yourself, is what happened in this case uniquely due to a vaccination, or is it just due to medical disease in life? So I turn to my medical director, my infectious disease colleague.
I think it's a complete tragedy. It's one more excess and unexplained death in this pandemic that we have to deal with. We don't know enough about the information. But like you said, even in the United States with 80+ million doses of vaccine given, we haven't seen this through, now 3 different kinds of vaccine. Absolutely tragic. Would like more of the information. I can't believe if there was an autopsy or the medical examiner would put death due to vaccine, it's usually more medical things such as stroke or respiratory failure.
And I think that's a good distinction to maybe make with this, because obituaries, I mean, I wrote my dad's, nobody,
Yeah.
it wasn't written, obituary was not written by a professional.
No, that's right. They are written by individuals, and so I just, again, I don't know the circumstance of this case. So my point about how you fill out a death certificate is this is how this is how you're supposed to do it. You're supposed to really understand the cause of death and to do the best you can to be honest and tell the truth. And I come back to my point. We have all these doses of vaccine that we've not seen anybody die from. What are the unique circumstances of this case that somebody could die from a vaccine? Is it possible that somebody has a reaction to a vaccine that is so severe they could die? Yeah, it is possible. It has happened in the history of vaccination across the world. We just haven't seen it around the COVID-19 vaccination, and I don't. And you don't want to your point. It is always a tragic loss. And if somebody did die from a dose of the vaccine, that is a terrible thing. Millions upon millions upon millions of people are suffering from COVID-19. Millions have died, and millions have long-haul syndrome and the things we've just described. And on balance, vaccination will save millions of lives more than it will ever touch in a negative way.
Yeah, I mean, certainly prayers out to that family and friends. I think, again, it can be something that continues to be investigated, see what the medical facts of that case are. But we know we have V-Safe specifically for the COVID-19 vaccines through the CDC and the VAERS, and those are two mechanisms to monitor for adverse events to the vaccine. So I think if it's worth investigating, certainly continue, and any of that medical team there can certainly raise that question and do some more investigation.
And to the family who suffered that loss, if indeed it truly is due to the vaccine, all the statistics in the world will not ease your pain.
Yep.
So my heart goes out to you, and I'm sorry for that loss, because
Well, and
it's no good.
he's one of the people that is on the thread that the community's having a discussion on this while we're having this discussion. They're listening to both discussions, which is what's really wonderful about this tool that we have. He did say that she had a history of severe reactions and had been intubated several times in her life. Would that make you...
That's tough. Again, I just don't know enough
Right.
of this individual story to know. I just don't know. And so I cannot draw any conclusion. Clearly, people who have had reactions to vaccines of different kinds before may have a reaction to this vaccine. We do know that there is a story around that. We don't always understand it. And that makes you more concerned. But I just don't know enough of the story here.
And in case you are, the specific question from the reporter is, what is your reaction to this kind of story, and what would you like to have included in it?
I think from my standpoint, it's what we've been saying. First of all, a heartfelt expression of grief and to the family that has lost somebody who they have loved, and to do something to think, well, it's from a vaccination, and gosh, maybe they would never have gotten COVID-19 and would have been okay. What I can tell you, and it doesn't help the pain of the family, right? This doesn't help the pain of the family. And as an ICU physician, and I deal with cystic fibrosis, and average life expectancy is 40 years old, so most of my patients die very young. And there is never a way to be okay with death from anything, whether it's a car accident or a heart attack, you will always feel that loss. And so the words will not take away that pain or that event. What I can say is I hope that in listening or hearing about that, if indeed it's due to the vaccine, the rest of us have to understand that while that pain in that isolated instance is not measured, we can't measure it for that family, and we can't find solace for that family. But we know that throughout the world and throughout mankind, there is no question that vaccines save millions and millions and millions of lives relative to the number who die. And that is true about any drug therapy, right? Well, the odds may not be as great, but there are drugs we take every single day, all right? I take Flomax for my prostate that is about the size of a grapefruit. And so why do I do that? Because there's some people who have bad side effects from Flomax, right? They don't do very well with it, or you could even have an allergic reaction and die from that drug. That can happen to you with an antibiotic. That can happen to you from sunscreen. I mean, anything can have a side effect. But what you don't want to do is, in this time where we have such great division in the country and such a big fight between red states and blue states, don't take this event and take it to such an extreme that you now say nobody should be vaccinated. Because the fact is, everybody should be vaccinated, because that's how we'll save the lives. And look at all the millions of people who have died from COVID-19. They all have that same sense of loss to the disease that no one wants to have. How do you prevent it? Well, you get vaccinated.
And Jim asked, is there a resource website that gives vaccine efficacy longevity data that's been gathered so far? Where can they go?
Yeah, go to the FDA and go to the CDC, and it's out there everywhere. You can go find the actual papers submitted by the companies to the Food and Drug Administration for approval. Their entire data set's out there for public viewing. It is complete transparency.
And ongoing, I think he wants to know, do they keep up with
Longevity
it?
of that, the longevity of that. How long will you get protection, right?
Yep. And there is no single spot. I think you just have to go to the CDC website, where they continue to try and gather that data and gather that information, and they do on V-Safe gather the side effect information.
Yeah, I would definitely start, for that question, I would start with the FDA and then use the CDC as well. There is also a Regulatory Affairs Professional Society, or RAPS, I believe. That does have a vaccine tracker in there. I don't know how up to date it is, but it has the EUA and approved vaccines, as well as those in being in trials as well, and they will keep theirs up to date. Mostly it's about the regulatory issues from the FDA, but they'll have data there too. But I would certainly start with the FDA and the CDC.
Dr. Woodward, how would you respond to patients in this situation? A primary care physician, people will turn to you and say, "What's up?"
Yeah, we have had questions about the vaccine and safety, and I think often it's related to family members or friends or people at work who've had reactions or something that they kind of saw on Facebook. And, again, it's the same thing. You just don't have all of the information to talk about, what went on in that case. And, a lot of patients also are asking specific questions about which vaccine should I get and which is the safest one and how long will I be protected. And again, we really heavily rely on the CDC and the FDA websites and try to review that pretty regularly and provide that information to patients as well.
Keith, you were...
I would say, first of all, condolences to the family. This is a tragic situation, like we mentioned. But I think, as I hear the information and deal with anaphylaxis not infrequently, you start to wonder. But every individual patient's risks that go along with their treatments of any kind, whether it is surgery or medications or vaccinations, are very personalized based on that person's health and overall well-being, and also the things they've been through over the course of their lives. And so it's possible to say that the vaccine in some way contributed to an anaphylactic reaction that potentially contributed to something down the line. As we said, we don't know all the facts right now, and this is why we have a system in place to study these things, because we do have to learn more about the information. But the overwhelming data so far suggests that the vaccines are generally very safe to get. And so because of that, I think I still encourage family and patients and friends to get vaccinated when they can. Obviously taking into account their individual risk factors that may go into that. But I think even when you do that, it's still safe for the vast majority of patients to go ahead and obtain that vaccination.
On the other complete end of the spectrum, Lindy is asking, have you seen any research on the vaccine helping decrease symptoms in long haulers? Anecdotally, there are reports of that.
There are reports of that. And Hawk, let's start with you, but I'll then turn to the whole panel about this question.
Yeah, all I know is the reports in the media. Again, anecdotal reports. I think that's great. This is one more positive thing for vaccination. We don't know what the mechanism would be. It is being investigated. Hopefully there will be some data and publications out about that, but I think that's great. If you do have it, one more reason to go ahead and get the vaccine. I don't know if you've heard anything more.
Dr. Woodward, have you seen that with any of your patients by chance, or talked with them about that?
Yes, I actually have. In the past couple of weeks, I specifically did have a patient who I had referred to the long haulers clinic or the post-COVID clinic. And this patient was starting to make some progress on her own through some of those treatments that were recommended. She did go and get the vaccine and has reported that some of her symptoms, especially some of the muscle aches and brain fog and things like that, have actually started to improve since getting the vaccine. Again, can't say that it was due to the vaccine. Physiologically, don't know exactly, the link there, but it is happening for some patients, and so it's another reason to go ahead and get the vaccine if you've had the disease.
Jill.
All right. Pamela says, I think I need to be part of the post-COVID clinic. I am on my 5th month dealing with COVID issues. I started therapy yesterday to try to help get my strength back. Will you tell me again, how do I become part of the clinic?
All right, Keith Sale.
So first step is to work with your primary care physician and have them refer to our clinic referrals line. So you can call our main campus, main number actually for referrals in our call center, and they will begin to organize you into that process and get you into our triage process, who will then determine where we can best fit you into the different specialties that might meet your needs.
So it's kind of based on your symptoms. So if you have loss of sense of taste, then they may, or smell, they may come to the ENT guys. If they have shortness of breath, they may go to the pulmonary guys or whatever. So.
Absolutely true. It's very symptom and patient specific, and so we get referrals that oftentimes have some information, like 5 months of COVID symptoms in your case. But as we narrow that down to specific issues that you have in your post-COVID recovery course, we can really begin to help you identify the best specialists to see and maybe even the right order to see them in, depending on how things are going with you. And so once you get into that process, you would expect to get a phone call from our triage team to help walk you through that.
Vicki has a great question, too. She says mental health mood symptoms are not in the V-Safe surveys after the vaccine is given. She goes, is there another way to report those symptoms? Maybe Vicki might want to
Great
get a referral,
question.
too.
All right, let's see. Hawk, I'll start with you. I don't know.
I don't know. Maybe Dr. Woodward no more. So V-Safe was specifically for COVID-19 vaccination. There is the Vaccine Adverse Events Reporting System, VAERS, which was one that has been around a long time. It might be there. I don't know exactly how to get to those. It's through the CDC website. But, yeah, I don't have any other information.
Dr. Woodward, do you?
Those are the two that I'm aware of as well.
Okay. Yeah, I'm not.
Yeah, well, the other way is obviously it's connecting with your clinicians, your teams, to document that you have these symptoms. A lot of folks will suffer in silence, if you will, with a lot of these symptoms. And if we can begin to at least have the information or the data out there in your primary care physician's record or in your psychologist or psychiatrist record, then all of a sudden we can begin to tie these things together after the fact, even if it's not in a large database. But so I think certainly seeking care for those things is also really important because the data then will be out there. It's just a matter of how we begin to mine it in the future.
And the data is out there because we know there are good published studies on this post-acute and these long hauler patients that specifically show that, just as you mentioned early on. That's one of the major ones.
And speaking of data, Catherine, and not the one that you might think of, Star Trek. Catherine wants to know, what percentage of COVID patients experience these long-haul symptoms? Do we know?
Yeah.
Yeah, it ranges. You know, if you look at the studies that are out there, it varies from study to study. I've seen as little as a third to up to almost 85%. I think the study from Italy, they had 160 patients, but 85% of those patients had long-term symptoms, and so I think that then you go to a bigger study that was done here in the U.S. and it was about 35% of patients. So I think it varies depending on the patient population that you're looking at. I think from what I've read, the patients who are more severely ill, the ICU type patients potentially have a higher incidence and a higher risk of these long hauler type symptoms versus the mild to moderate COVID patients. However, I think it impacts both groups, and so I think we're still learning a little bit about the more mild to moderate group.
Yeah.
3 more questions, please. All right. Chris wants to know, what resources are out there to help me with my long haulers? I'm wondering, is there an online support group? Maybe we should start one or something. Where can they go?
Dr. Woodward, any thoughts about that?
I think first just connecting with your primary care providers. I do think that creating some type of, group support would be a good idea because now we can kind of do everything safely and virtual. And for those patients who are interested, I think that, hearing and speaking with other individuals who are suffering with the same symptoms that you are can be really, really helpful. And in some cases, you can see some improvement just because your mental health is improving by having that group support. So I do think it would be a good idea and connecting with others who are dealing with the same thing that you are.
Yeah, I would say our behavioral health team would agree with that statement. And I think there are existing groups that are out there. If you look at some of the literature, whether they're on Facebook or blog sites or wherever, there are folks who are already starting to have some of these conversations. I think on our roadmap, if you will, for the post-COVID clinic, I think this is a part of that. We haven't quite gotten to that level yet. We're trying to put a bunch of information on our website, so we have resources for patients to look at. Leslie Spikes, who you mentioned, has really worked with our communications team to develop a post-COVID kind of a guidebook. I don't know if it's actually been published yet, but I know it's in the final stages of being put into preparation for the website. And then I think ultimately trying to facilitate group sessions or group discussions with the community would be a great next step.
So build in the plane while we fly.
You bet. Seems to be the case with COVID.
Okay, Jerry wants to know, what are your thoughts on the 89 in Minnesota who had the vaccine and then got COVID?
89 people.
I know. It's unclear whether.
Yeah, I'm not sure that story actually.
It
What
could
we
be
know
an
is
89-year-old or an 89-year-old.
Yeah, I don't know the story. What we know is you can still get COVID.
Yeah.
I mean, the whole point of vaccination isn't that you won't get COVID, or we think it decreases the incidence. What it does is it prevents you from hospitalization and death.
Yeah.
That's the important part. That's what makes you so safe. So, yeah, you're still going to get COVID. I mean, that can still happen, and that's what we have always said. Even when vaccinated, you got to be really careful because we're not sure how much your ability to communicate that to somebody could be, that is to give it to someone else. And so, yeah, you can still get COVID. We do think that the odds of your getting COVID go down, and clearly the incidence of being symptomatic go down. And, one thing we should remember is that in our own hospital, we were averaging 25 to 30 new COVID positive employees a day, and now we're down to 0 to 1. So the vaccine has a protective effect, but it also, more importantly, keeps you from hospitalization and death.
Yeah, I think that's an important point. First of all, nothing is 100%. Any of the tests we do to look for disease is not 100%. Any of the treatments we give to help treat your disease is not going to be 100%. Even all the vaccines, nothing is 100%. So although in the trials, all those numbers look great, 100% to prevent death, they were very good large numbers, 30,000 plus people, so that's an extremely good number. But as you get into millions and hundreds of millions of people being vaccinated throughout the world, there will probably still be death in those that have been vaccinated. But just understand that overall, your risk of death and severe disease is significantly reduced by getting the vaccine. But you can still probably get the infection and also maybe even have symptoms, but more the likelihood of you going to the hospital, going to the ICU, and dying is extremely low.
It's almost zero, right? I mean, that's what the data shows us with all the shots.
Okay, so I'm going to give Christy the last question because I have a personal vested interest. My husband's going to get ready to get on an airplane.
Okay.
He just got a shot, and he's only 2 weeks out. I'm a little nervous. She wants to know, what amount of protection do we get with the first shot and when?
Oh, boy, that's a long-winded question, Hawk.
Yeah, I mean, I think
not a question, a long-winded answer.
The easiest answer is that probably by about that 12-day mark, you start to get an antibody response, an immune response, and we can see that in those curves, those data curves that were presented to the FDA in Johnson & Johnson, Moderna, and Pfizer, that shows at that time you do see the split, meaning that the people that got the placebo continued to get infections, whereas the people who got the vaccine, it was significantly reduced. So you're not fully protected at that point in time, but really after about that 12 to 14 day, you should have some sort of mounted immune response with B cells, T cells, and antibodies.
Well, that makes me feel better. I don't know about Christy.
You're a lot better off at that 12 to 14 day mark than if you did not get the vaccine at all.
That's exactly
How about that?
right.
You should still be wearing the eye protection, the face
mask,
the hand sanitizer, maybe not eating and drinking on the plane, right?
No.
All those things.
That's what I told him. He is not to take that mask off.
Yeah.
Okay. Hey, tomorrow the FDA is expected to approve a medical breakthrough treatment for multiple myeloma. And again, in context of our earlier discussion, every therapy, new or old, has side effects. But look at this one. It's a drug to treat multiple myeloma. Nice. It is the third leading blood cancer affecting in Americans. It is remarkable news. Dr. Abdullah is going to be here to help us discuss that. This may almost be a cure for COVID-19. Now,
Multiple myeloma.
I said, oh, God. I wish I'd said
We listen every word you say.
It will be a cure for multiple myeloma. That is and for those of us who have been in medicine for approximately a very long time, that is an overwhelming statement. It's kind of like I cried the first few times I watched patients get Trikafta and come back to clinic and look normal. I mean, with cystic fibrosis, and that's this therapy. And so, again, it'll have side effects. And to our earlier discussion, everything has side effects. But man, what price the pursuit of perfection? We're going to come back to that point in a moment. But this is going to be a great discussion tomorrow. He is going to be talking about this. It's going to be awesome. Dr. Amanda Cackler, as our Director of Quality and Safety, will be here with Hawkeye. David Wild will be subbing for me tomorrow to answer your questions about COVID-19, so that'll be great. So let's go back to our guests. Final thoughts for the day. Jennifer Woodward. Or Dr. Woodward. Gosh, I am just doing great with names and everything today. I'm all over the map.
Yeah, I think that, after everything that we've talked about today, I think, the importance of vaccination is important. Any issues that, could happen after, like we talked about, report them to your primary care provider so that we can help And then, if you be as careful as you can out in the community, but if you do still, get COVID, and there are some tools out there that can help support you to feel safe at home, and especially kind of monitoring those oxygenation levels.
Yeah, thank you. And thanks for being on our program today. Come back anytime. Dr. Sale.
I would just say, for those folks who are suffering with chronic COVID symptoms or post-COVID or long haul or whatever you want to call it, we're here to be a resource for you and for your primary care physicians. We're still building the plane while we're flying it. So if you can be a little bit patient with us, I think we'll make this into something great for you and for your teams. So please work with us, and we'll work with you to try and take care of these long haul symptoms.
Yeah, so important. Hey, so I am out next week. I am be taking a little R&R. My wife and I are headed out to Colorado. That'll be a great time. We're going to go see one of our very, very good friends, Dustin Harcourt. He is the head of, he owns Harcourt 3G Fly Fishing, and we're going to be doing a little fly fishing and a little skiing next week. So it'll be a really big mental health break, and looking forward to it. You may get a video from me, especially if it involves a big trout. You may see that. We want you all, though, to make sure you take care of yourself, eat well, drink plenty of water, and get a good night's sleep, exercise, do those things that are going to make sure your health habits are strong. I want to come back to that point. So I made just a moment ago. So, a really great person here at the Med Center brought me a gift, because I'm a Star Trek guy. Here's my reference team. Can't leave without a big one today. The show Discovery is one of the Star Trek episodes. One of the reasons I love Star Trek is that in many ways it's about faith, hope, and science. Faith in each other, faith in your team to get what seems like the impossible done, and for me, faith in God. Hope, because hope gets us through the darkest of times, and science to help deliver us to the other side. I got this gift. It's a shuttle from the USS Discovery. In American history, there was a shuttle disaster, the Challenger disaster, and a number of people died. And that was a tragedy. There was a school teacher on that. I think one of the first women in space. And we didn't stop the space program, right? We didn't stop. Because faith, hope, and science, they get us through a lot. At what price the pursuit of perfection? If you wait for the perfect treatment, you will never be answered, because there is no such thing. And vaccination is just like that. There is no perfect vaccine. Everything we do has a side effect. When you get in your car, you take a risk. When you walk across the street, you take a risk. When you get vaccinated, you take a risk. But if you search for the perfect risk, there is no such thing. So what do? You have to look at the data. You have to believe in faith, hope, and science to get us through this crisis and so many other crises, whether you're talking about the Challenger space shuttle or whether you're talking about vaccination. Those things help get us through the other side of the pandemic so we can get a return to what our new normal will be. And it will look a lot better than what it's been for the last year. But the only way we get there is for each of you to answer a call to arms and to make sure that that vaccine helps keep you safe. There will be few, a very, very, very unfortunate few, for whom that risk of vaccinating may have been greater than the risk of the disease. But they are very few indeed, because the reality is COVID has killed millions, and the vaccine will save billions. The math is clear. And we have waited through this pandemic from faith and hope, and here is the science that can get us back to normal. Make sure that you don't let fear stop you from faith, hope, and science. And while you're along that journey, keep your mental health intact, sleep well, exercise well, eat well, take care of yourself. Watch a little Star Trek. We'll see you when I get back. You'll hear from me while I'm gone. Take care out there. And remember, there's still no place like home.
What I often see is patients come in with sleep that's out of whack, and if you dive a little bit deeper, they often have mental health issues, typically insomnia and anxiety and depression. And when you have insomnia that becomes perpetuated, then oftentimes you've got mental health issues that are already there. The patient may not even know that they're there, but you add in sleep deprivation and sleep issues to it, and the mental health issues rise up. Aiming for 7 to 9 hours of sleep, keeping a consistent wake time every single day, 7 days a week. What that will do is it will allow your sleep cycle to fall into sync. No naps. What that does is it recharges the melatonin levels in the brain and it resets things, so then in the evening they find it harder to fall asleep at night. We lie down and we just think that we're de-stressing and we turn on our phone and then we start doom scrolling. We start scrolling through Facebook, seeing what other people are doing, scrolling through social media, reading the news. There's nothing good in the news out there right now, and we find ourselves just immersing in that, and it actually can increase our stress levels. Many of our hormone levels are guided by our circadian rhythm, and our brain and our hormone, it all recharges and resets itself at night. And so if you are shortening that, then you are shortchanging your overall health. I often tell my patients mental health and sleep are like an old married couple. They go hand in hand together. If one's unhappy, the other's unhappy. If one's peaceful, the other's peaceful.